Hello everyone. Today I am going to tell you the details of peripheral intravenous line or catheter placement, or we can say peripheral intravenous cannulation. This will cover the competency PE 24.16 and 27.20. Today you will learn the indication, various sizes of IV cannula, its parts, what are the sites for the IV cannulation, then procedure, complications and contraindication, and in last I will show you the checklist. Indications of peripheral IV cannulation are: we can use it for short-term administration of drugs, fluids, blood and electrolyte and nutrition. This is the most common procedure we perform in the pediatric patients daily. So for administration of all these products, we have to insert the IV cannula. Now the sizes of peripheral intravenous cannula. Size vary according to the age of the patient, and the size is the catheter size in gauge. So we in units we prefer the either 26 or 24. So in preterm 26 size and in full term neonate 24 size. In infant either 22 or sometimes we use the 24 size also. In children 20 size we can use. And these IV cannula are made of either polyvinyl chloride material or polyurethane material. We should prefer the polyurethane material IV cannula because it is less thrombogenic. In this image you can see the various sizes from the 26th till the 18th gauge cannula. 18th gauge we use in the adolescent children when they are having the weight around the 50 kg. Now in this table you can see the various sizes of IV cannula and these are the color codes. And higher the number, narrower the catheter size. So 26 is the narrowest catheter size and 14th is the largest catheter size. And 16th and 14th used in the adult patient and color code for them are gray and orange, while 26th till the 18th we can use in the pediatric patients up to the 18th years age group. And these are the various color codes. Now the parts of IV cannula. In this video I will show you the various parts. So here I am separating all the parts. This is the cape over the catheter, and here you can see this is the bevel needle. Now I am removing the needle from the catheter. So here this is needle and this is needle grip, and this is the flashback chamber, and this part is lure lock plug. Now in the catheter you can see this is the catheter and this is wings and the hub, and this is the injection port cape, and this contain the color code. So this is pink color 20 gauge, and this port cape over the lure connector. So these are the various parts of the IV cannula. Now again I am assembling all the parts. Here you can see in the video. Now the site for the IV cannulation. The preferred vein should be straight in the distal part of the limb and non-branched. So first we should try in the dorsum of hand, in the metacarpal vein which drain into the dorsal venous plexus. It is the preferred site. If not possible to insert over here, then in antecubital fossa in medial cubital vein. If not possible to insert in the upper limb, then in foot in dorsal venous plexus, in leg, great and small saphenous vein. If not possible to insert in both upper and lower limb, then in neck in external jugular vein. In infant, scalp veins are also visible. So frontal, occipital, superficial, temporal, postio-auricular veins are visible in infant. So if not possible to insert in the limbs and neck, then we can try in the scalp vein also. Now the procedure of IV cannulation. So first step is we have to clean the hand at the site of puncture. So in this video you can see and start inward and make the circular motion outward. Also, stretch the skin. It will help to prevent the rolling of vein. And other person should hold the limb proximal to the site of puncture. It will act as a tourniquet. Because in pediatric patient they will move the limb. So to prevent the movement of the limb, some other person should hold the limb proximal to the site of puncture, just like a tourniquet. Now the second step is choose the correct size of cannula and insert at the 15 to 30 degree angle. So in this video you can see, and simultaneously stretch the or pull down the skin to create the traction. Here you can see, and we should also keep in mind that needle side is bevel up, so the beveled part of the needle should be upside. Now in this video you can see the third step. Once the skin is punctured, gives way feeling will be there. You have to advance the needle till the blood backflow is visible in the flesh chamber. After that, just you have to advance the cannula forward till it touches the skin, and after that you have to press the vein proximal to the cannula and pull out the needle. Then keep the constant pressure proximal to it and check the patency of the cannula by pushing the 2 to 5 ml of normal saline. So in this video you can see, and so it is freely going into the vein. Now proximally continuously you have to put the pressure over the vein and put the lew lock plug. Now the last step is put the dressing. So dressing should be transparent, non-occlusive over the cannula. Also we have to record the date of insertion. So here you can see this is Tegaderm transparent dressing. So if the patient is having any swelling, it will be visible in the transparent dressing. So first we have to keep the dressing over the cannula, and then over the wings also we should fix the both the wings. In this video you can see. So this is the procedure for the IV cannulation. So these are the steps of IV cannulation. First step, clean the area, stretch the skin, place the tourniquet. Second step, insertion at the 15 to 30 degree angle while continuously creating the traction over the skin. And needle side is bevel up. Once the skin is punctured, you will have the gives way feeling and the blood flow will be visible in the flesh chamber. Then advance the cannula forward and slightly retract the needle. Then keep the constant pressure over the vein. Also check the patency of cannula by pushing the 2 to 5 ml of normal saline with the syringe. Then attach the lock plug. Then do the dressing and record the date of insertion. Now when to remove the IV cannula? It is used for short term only. So ideally we should remove within 3 days. Maximum we can keep up to 5 days. What are the complications of IV cannula? Bleeding can occur at the site of cannulation, hematoma formation can occur. Even sometimes, if we wrongly place the cannula in arteries or nerve, then damage to the artery and nerve occur. Phlebitis and thrombophlebitis can occur. So it is also asked in the viva, difference between phlebitis and thrombophlebitis. So whenever vein is simply inflamed, it is known as phlebitis. When also complicated with the thrombus formation, so inflammation and thrombus both occur, then we label as a thrombophlebitis. And the causes of thrombophlebitis can be the trauma to the vessel wall, or sometimes if we have not used the proper size of the cannula, or sometimes because of the bacterial colonization. And the most common bacteria which lead to the thrombophlebitis is Staphylococcus aureus. Thrombus formation can occur and infiltration extravasation can occur. So again it is asked in the Viva, what is the difference between infiltration and extravasation? So whenever there is a leaking of non-vesicate solution out of the vein, it is labeled as a infiltration. And whenever there is a leaking of vesicant solution, we label as a extravasation. Example of the vesicant solution are example dopamine, dobutamine, inotropes, calcium gluconate, because it damages the soft tissue more. So whenever you find infiltration or extravasation is there, stop the infusion and remove the cannula. Sometimes patient can develop the catheter associated bloodstream infections also. So all these are the complication of IV cannulation. Now what are the contraindication of peripheral IV cannulation? There is a no absolute contraindication. Relative contraindications are if the patient is suffering from any coagulopathy, if the local infection or burn at the site of cannulation, then don't do it. If having the compromised skin at the site of insertion, or if the patient had the previous lymphatic nodal clearance because of any reason, or AV fistula formation or deep vein thrombosis on the affected limb, then don't perform the IV cannulation in that limb. Now this is the checklist by which we assess the student. So we will check student is able to swipe the insertion site with the spread, then with betadine, then again with the spread. Inserting the correct size of IV cannula at the 15 to 30 degree angle. Is inserting the needle till the flashback of blood seen at the back of cannula. Then student is progressing the cannula further, holding the needle, advancing the rest of cannula, is removing the needle fully, applying the pressure at the vein at the tip of cannula, able to fix the cannula properly, maintaining the universal precaution. Now in this video I am performing the IV cannulation in a mannequin. So for the undergraduate student, they have to do the IV cannulation in mannequin during the clinical posting also and during the exam also. So this is all about the peripheral intravenous cannulation. Thank you so much. If you are having any query about this topic, you can ask in the comment box. Thank you.